As summer sets in, eye care experts are sounding the alarm on a growing trend affecting kids across the country. It's myopia or nearsightedness.
Yeah, so with all that screen time, and it's at an all-time high, in fact, and outdoor play on the decline, children's vision is being impacted earlier and more severely than ever before.
So joining us live via Zoom this morning with tips for families is pediatric optometrist with Cooper Vision, Dr. Felicia Timmerman. Thank you so much for being here.
Thank you for having me.
And what exactly is childhood myopia, and why are we seeing such a dramatic rise in cases?
Myopia, otherwise known as nearsightedness, is really due to the eye growing faster and longer than it should, which is leading to distant objects appearing blurrier. Now, we know that this can have an impact in the overall lifestyle of children, particularly in those learning environments. And that rise that we're seeing is really contributing to these changing lifestyles of children, spending less time outdoors and more time on those screens.
And so what does science, though, tell us about outdoor time and vision health?
Research shows that outdoor time can actually be a protective factor in delaying or preventing the onset of myopia. So it's important that we encourage children to get an hour and a half to 2 hours a day of outdoor play in order to receive that benefit, but also to be able to limit that screen time recreationally as much as possible.
And are there innovative treatments that can help, especially for active children?
The great news is that we have the MySight one-day contact lens, the first and only FDA-approved treatment to slow the progression of myopia in children at 8 to 12 years old at the initiation of treatment. This is a daily disposable contact lens, meaning a fresh pair for that child each day, and they're going to receive a dual benefit of clear vision similar to what they would see in standard contact lenses or glasses, but also simultaneously being able to slow the progression of the myopia due to the innovative technology of the design embedded within the contact lens.
And for parents that are concerned, what else can they be doing?
Ensuring that their children are getting those annual eye exams with an eye care provider to check the vision and eye health, but also to see if the child developed myopia and could be a candidate for the MySight lens. Now, parents that are concerned about contact lenses for their child, research shows that children as young as 8 years old can safely wear MySight, as well as 90% of the children 8 to 12 years old at the start of wear prefer their contact lenses over glasses.
And where can our viewers at home go for more information?
The MySight website, which is mysight.com, to learn more about myopia, MySight one-day contact lenses, as well as there's also a locator to find an eye care provider near you.
All right, Dr. Timmerman, thank you so much for joining us this morning. We appreciate it.
Thank you so much.